Hello and welcome to today's episode on Life Saving Aid. Today we are going to be looking at Lassa fever, a very dangerous infection. However, taking the right actions can help prevent this infection from occurring, or in case of an infection, can help increase the chances of survival of its victim. It's important to note that Lassa fever is caused by Lassa virus, and this Lassa virus is found in an infected mastomys rats. And these rats are commonly found in West African countries, especially countries like Nigeria, Ghana, Mali, Benin, Sierra Leone, Guinea, Liberia. It's important we note that Lassa fever is also high in certain states in Nigeria, like Edo, Ondo, Bauchi, Taraba, Benue, and Ebonyi states. It can be found in any state in Nigeria, and it can be found in any country in West Africa, but the countries we listed earlier, these are places that it's common. Another information you need to know that is important about this mastomys rat is that these rats don't fall sick from the Lassa virus infection. They are carriers of this Lassa virus. So when you see this rat in your environment, please treat it as though you are seeing a very venomous snake. It's also important to note that the peak of this Lassa fever infection is around the dry season, from the months of November all through to April. So what do we do in order to stay safe, especially during the peak season of Lassa fever? We are approaching the peak season of Lassa fever, November to April. So what are the things we can do in order to significantly reduce the rate at which people come down with Lassa fever infection? One, rodent control. What does that mean? Anything and everything you can do to eliminate the population of rats within your home, around your environment, it's very, very important. Next one is proper food handling. Proper food handling. The reason is that when these rats come into our home, they come in search of food. And so when they eat our food, they stool on it, they urinate on it, and they drop their salivas on it. These are things that carry the Lassa virus. And so when a human being comes in contact with this food item and consumes them, the human being is at risk of coming down with Lassa fever infection. So what do? You handle your food properly. Please and please do not leave your food uncovered. Leftovers should be properly disposed. Use what we call rodent-proof containers to store your food items. Food hygiene. Food hygiene is very, very important. It means you clean your food properly before consumption. Food that need to be cooked before it is consumed should be properly cooked before it is consumed. Next is hand hygiene. It's very, very important, especially washing your hand with soap and water for at least 60 seconds. Between 40 to 60 seconds, you wash and scrub properly. So whenever you make contact with surfaces that you are not sure if it is clean or not, especially when you see droppings of rat around that environment, please and please, before making contact with food or before putting your hand in your mouth or shaking someone, please wash your hand with soap and clean running water for 60 seconds. Now, in case someone comes down with Lassa fever infection, what can we do in order to help increase the chance of survival of the victim? When you are able to identify Lassa fever infection early, you can take actions that can help increase the chance of survival of the victim. So what are the early symptoms you see in Lassa fever? Number one, the person might have fever. You see fever that is not going away. You've treated first day, second day with the routine anti-malaria medications around you, and it's not going away. Please start thinking of Lassa fever, especially if you are in an environment that Lassa fever is common, like the states we mentioned in Nigeria, that Lassa fever is common. Please start thinking of Lassa fever. You generalize body weakness. They are feeling weak. They are having malaria. Malaria is a feeling of unwellness, whereby you are not yourself, but you are not totally sick. Okay, the person is complaining of headaches. Please and please start thinking of Lassa fever. Once you've treated malaria, first 3 days, you're not getting any better. Please and please start thinking of Lassa fever. The reason is that if we are able to catch this Lassa fever infection early, the chance of survival of the victim is significantly increased. The other symptoms you can find in someone who is suffering from Lassa fever infection, you start hearing things like chest pain, abdominal pain, muscle pain, the person is vomiting, having diarrhea, and then you now start hearing that the person is bleeding either from the ears, the eyes, the nose, the mouth, the gums, or even the private area. Make arrangements for the victim to be quickly moved to the hospital. Please, we should not attach stigma to Lassa fever. Be open and be honest about your travel history or your contact history. That way we can together reduce the number of people coming down with Lassa fever and significantly reduce the number of people who die as a result of Lassa fever. I hope this information helps someone out there. Share this video so that together we can raise awareness on Lassa fever, reduce the rate at which people are coming down with Lassa fever infection, and increase the chances of survival of victims of Lassa fever.